In this chapter, we will be discussing self-monitoring. It is very important to monitor how your body is responding to the TPN. In doing this chapter, we will discuss what you should monitor for, some early signs and symptoms, and some actions to take to avoid problems. For this, you will need the initial log that is sent out during your first delivery, your self-monitoring TPN log, and your oral thermometer. So the first thing you want to monitor is your site of your catheter. You always want to make sure that you are monitoring for any redness, swelling, or drainage at the insertion site. If you notice any of these, that could indicate infection. If you do have any of these symptoms, please call Fairview Home Infusion. The second thing we want to monitor, like we've discussed in other chapters, is your oral temperature. You are going to do this right before you start your TPN infusion and 1 hour after starting your TPN infusion. If you notice that you have 100-degree or higher temperature, if your temperature is 2 degrees above your baseline temperature, or on that second check after running the TPN for an hour, you notice that your temperature has increased by 2 degrees or more, you want to stop your infusion and call Fairview Home Infusion. You may also be asked to monitor your blood glucose or your blood sugar. This is done at the discretion of your provider or your physician. To do this, you will be instructed by the nurse who comes to your home on how to specifically do this. Just note that if you have any lightheaded, dizziness, nausea, thirst, any of those symptoms that are abnormal, and you do have a glucometer or a blood glucose checker in your home, check your blood sugar and call Fairview Home Infusion. A couple other things that we monitor on a daily basis is your weight. You want to monitor your weight the same time of day, wearing the same amount of clothing. If you have a weight gain or a weight loss of 2 pounds in a day or 5 pounds in a week, you want to contact Fairview Home Infusion. This could indicate that you're getting too much or too little fluid in your TPN bag. You also want to record your intake. This includes your TPN, any hydration that you are doing, as well as anything that you are taking orally. You also want to monitor the amount of food and fluid going into your body. This includes your TPN, any hydration that you may be receiving IV additionally to your TPN, or any fluids that you take by mouth. You may also note any swelling on your feet or your hands, which may indicate too much fluid, or if you feel weak, your legs are crampy, that may indicate that there's too little fluid in your TPN bag. If any of these occur, call Fairview Home Infusion. You also want to monitor your output. This includes vomiting, diarrhea. If you have an ostomy or a fistula, the output from those. You also want to monitor the amount and color of your urine. If you're having decreased urine or the color is becoming darker, call Fairview Home Infusion. In addition, if you have any abnormal symptoms or symptoms that are getting worse, such as pain, easy bruising or bleeding, shortness of breath, anything that is abnormal, call Fairview Home Infusion to discuss. There is also a log at the back of your self-monitoring log where you can put all of your recorded routine daily monitoring. For management of your TPN, it is not uncommon for your nurse to draw weekly labs. This will be discussed with you in the plan of care with your nurse.